A new $2 million report on Alberta's pandemic response is calling for a halt to COVID-19 vaccines. But the document is being widely criticized, called anti-science and anti-evidence by the Alberta Medical Association.
We were pretty disappointed in the findings and how things were represented.
The NDP opposition agrees, arguing the money should have instead been used to improve health care.
$2 million would have funded orthopedic surgeries at the Royal Alex Hospital for 8 years. And we spent $2 million to throw taxpayers' money at every anti-vax extremist around the world, not Albertans, not experts.
The report, released last Friday and prepared by 13 doctors and academics, says, quote, the number of COVID-19 infections did not decrease despite the implementation of mask mandates and widespread vaccination. And it cannot be concluded that these COVID-19 vaccines are safe. Naheed Nenshi is now calling on the Premier to clearly state whether or not she supports the findings.
Premier, take a stand. Either you believe in this stuff and you believe in spending taxpayer money on it and you're going to implement it and we want to hear that from you. Or admit that you're just doing this to pander to extremist base.
The AMA says the report ignores scientific consensus, sows distrust of health professionals, and did not properly take into account the experiences of frontline workers.
How about a bunch of experts, physicians, nurses, respiratory therapists who worked for months and months and months looking after patients and unfortunately watching many of them die?
Other experts agree the report is problematic. U of A professor Timothy Caulfield taking to social media to call it misinformation and nonsensical. A statement from Alberta's health ministry defended buying the report, claiming it's important to consider a broad variety of perspectives. Still, the government is making no promises that any of the recommendations in the review will ever be implemented. From Edmonton, Sean Amato, City News.